Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Kayode Okikiolu. Here are some of the highlights. It's week 2 of the safe reopening of schools and learning facilities in the country. We continue to follow schools' compliance with the federal government's guidelines. With a mandate to meet majority of people's health needs during their life, primary health centers are a major component of Nigeria's response to COVID-19. But how well have they performed? And a lesson of caution from Australia as it records its deadliest day of the COVID-19 pandemic. How did a country which was faring relatively well enter a second wave of infections? Welcome to the program. Nigeria currently has a total of 12,446 active cases of COVID-19 in all the isolation centers across the country. And that's according to the latest figures from the NCDC. With 437 new cases recorded nationwide in the last 24 hours, Nigeria now has reported a total of 46,577 confirmed cases since February the 27th, when the nation recorded its index case. Meanwhile, the total number of fatalities also stand at 945, with 33,186 discharged. The new cases are in 16 states and the FCT. Lagos leads with 107 cases, FCT 91, Plateau 81, Kaduna 32, Ogun 30, Kwara 24, Ebonyi 19, Ekiti 17, Oyo 8, Borno 6, Edo 6, Kano 6, Nasarawa 3, as well as Osun, Taraba, while Gombe 2, Bauchi recorded 1 case. Well, let's head over to Ekiti State. Talking education, resumption of schools began first with teachers last week to enhance adequate preparation for the students' resumption today. Well, at schools visited within and outside the state capital, the necessary items for safety were put in place as teachers took up supervisory roles to ensure compliance. The halls for the examination have been set in most schools, while others are tidying up necessary arrangement. The state governor, Dr. Kayode Fayemi, had on Sunday gone round the schools across some local governments to ascertain the level of their preparedness. He also ordered last-minute fine-tuning at the schools, which were deemed not fully prepared. Turning our attention to Kaduna State, where it appears parents and guardians are not entirely confident enough to allow their wards to return to school. And this is basically because of a low turnout of students, which we recorded today. For the ones that resumed, however, it will appear that they are not mindful of the inherent danger which the pandemic poses, as many of them failed to wear their face masks. A visit to some public and private schools in the state's capital shows desks physically distanced, smaller class sizes, and wash facilities in front of the gate. Well, there's been intense debate about the risks resumption poses to children, teachers, and their caregivers as well, and whether resumption of schools will create a second wave of COVID-19 infection in the country.
We've been working tirelessly for the past 2 weeks because our students will be resuming today being 10th of August, 2020. And from the gate, based on the guideline from the State Minister of Education, National Private School Board, and what have you, we have put all arrangements on the ground for our students to resume today. We have hand sanitizer, we have water, we have at the gate there, you have seen yourself. Then all our students have been instructed to come in with face mask, and you have seen them. They are all prepared to continue from where they stop. All our environment and classes have been fumigated last Friday. The social distance will be there, and we have prepared their minds for it. You can see from what they have done. They are ready.
in the education sector where most students have resumed across the country. In Benue State, our correspondent reports that the government has constituted an enforcement committee which comprises staff of the Ministry of Education and all education area officers to carry out daily enforcement on schools to ensure compliance to the use of face masks, temperature checks and hand-washing points throughout the resumption and examination period. The Commissioner for Education, Professor Dennis ITYAVYAR, disclosed this to Channels Television while monitoring compliance to the safety protocol, which was outlined by the federal government for the resumption of schools for the West African Examination Council exams.
All the schools, especially government secondary schools, thermometers have been supplied. Also to monitor the resumption, and that is why I'm here this morning to monitor. What I have seen is good. The responsibility of the parents were to ensure that the children come back with face masks and hand sanitizers. I have found that the parents are also complied. And the responsibility of the school was to fumigate and ensure that the whole place is good for the students to come back. And I am very impressed with the principal and staff of this college because everything is perfectly done. The students are looking very neat. Each and every child has face mask. And the seating arrangement which we required, there is one child per desk. And I'm very impressed, and I hope that other colleges are doing the same.
Well, now that worship centers in Delta State have reopened, the state government is not relaxing in its efforts to ensure that safety is maintained with the continuous sensitization of residents on the dangers of COVID-19, as well as ways to prevent the spread of the virus. But this time, COVID-19 survivor and index case of the virus in the state, Austin Eroto, takes the COVID-19 campaign to the mosques in Warri, where he narrates his experience and how contracting the virus can be prevented. On arrival at the mosque, other than the provision of water for hand washing, worshippers were clearly seen not adhering to other safety protocols as advised by the NCDC, such as observing social distancing, as well as the use of face masks. Some of them are appreciative of a sensitization, as they observed that it may have helped to clear the doubts that they may have had concerning the pandemic.
On our way coming to Igudu Market, to the mosque here, you yourself, you saw them, and a lot of people were not putting on their face masks. And I really felt that this is ignorance, because ignorance is in the trap of its own victim, right? But when we are doing this, I'm just doing this because of the passion, and I believe that after my talking to them, they will follow the rules and regulations of the NCDC.
Thank God for the golden opportunity I have today, because for the first time I thought this is not real. Because in my lifetime I've never seen anybody with that. I'm just hearing it, but I've never seen it with my eye. But today, thank God, I see somebody that says that is the victim of that, and he assures that he swear to God he is the victim. So therefore, we as a Muslim, we're supposed to believe that this thing is real. That's why I put on and from today I'll continue using that.
So, according to the WHO's document, Role of Primary Care in the COVID-19 Response, primary health care is an essential foundation for the global response to the coronavirus disease. Well, the WHO said primary care plays a significant role in gatekeeping and clinical response, differentiating patients with respiratory symptoms from those with COVID-19 and early diagnosis, as well as other issues. So let's touch base with the Executive Director and the CEO of the National Primary Healthcare Development Agency, Dr. Faisal Shoaib. Good afternoon, and thank you for joining us on the program this afternoon.
Good afternoon. Thanks for having me.
Well, in the intro to this discussion, I just outlined what the WHO said will be the major role primary healthcare centers should play in fighting this scourge of COVID-19. The question is, in the Nigerian context, how active have PHCs been in this fight?
Right from when we recorded the first case of COVID-19 in Nigeria, the National Primary Healthcare Development Agency, working with our development partners, our donors, and the states, actually put together a document that we call the COVID-19 Preparedness and Response Plan. And right after we pulled together that document, we went about training primary healthcare workers, including community members. So the National Primary Healthcare Development Agency has been working with the state ministries of health, knowing very clearly that as an agency, we have a very important role that we play in terms of making sure that when clients come to the primary healthcare centers, that they get the requisite care that they have, and that they are prevented, they are protected from catching COVID-19. So in the course of the last few months, what NPHCDA has done has been to work under the remit of the Presidential Task Force to train over 200 primary healthcare workers and community members. We've worked with traditional leaders, and we continue to work with them, with religious leaders, with faith-based organizations and civil society, to make sure that the correct information is provided to community members around how they can protect themselves and also protect their loved ones. So the primary healthcare system is very, very critical towards our ability to flatten the curve of the COVID-19 outbreak in Nigeria. And we've been working in close collaboration with the Nigeria Centers for Disease Control, the Federal Ministry of Health, all of this under, one plan, one cohesive and coherent national response that is led by the Presidential Task Force on COVID-19.
Right. I mean, we moved into the community phase of transmission months ago, and it's been a major challenge, especially when you hear about people managing the symptoms at home care, and what have you. But regarding primary health care centers in the country, one wonders, are they allowed to maybe test or even manage COVID-19 cases? Because I know you have a department that talks about laboratory services and what have you. So are you allowed to maybe test, manage, and is that something you're looking into?
So right now, it's a no-no when it comes to treating COVID-19 in primary healthcare centers. We're very clear about what the roles of primary healthcare centers are. It's around promotion, prevention. It's around cure, treatment. It's around how we're able to provide rehabilitative interventions when it comes to any disease. The COVID-19 outbreak clearly is too complex a disease for primary healthcare workers to treat. So what we taught the primary healthcare workers and what they're actually implementing is that once there's a high index of suspicion, that they will refer to the next level. So the primary healthcare centers are not involved in the treatment as of now. What primary healthcare centers are doing, though, is making sure that they triage, that is to say, they identify those patients that have typical symptoms of COVID-19, and they reach out to the next level of care to say, to the disease surveillance and notification officers. We have a case here in the primary healthcare center. We will need them evacuated. And in terms of testing, the Presidential Task Force is working on a guideline now that will emphasize testing at the tertiary care level, at the secondary care level, making sure that in every ward there will be a testing center where people can go to and they'll have their samples collected. In wards where there is no tertiary, secondary, or primary healthcare center in the vicinity, then that is where we will now in the future look at what is possible, working with the private sector, how we can increase testing centers. So we're still looking at how we can do this safely. The most important thing for us at the Presidential Task Force and at NPHCDA is how we can make sure that while expanding the ability of the response to test, that we do not put primary healthcare workers at risk of contracting the disease. So all of what we have done at NPA-CDA is seeing how we can actually make sure that people access care in these very difficult times in a way that is not only safe for the primary healthcare workers, but it's also very safe for community members. That is why, apart from providing the information that they need around COVID-19, we've also printed out information, education, and communication materials in different languages. We've had public service announcements, to encourage community members to go to the health facilities.
Okay. Dr. Shaw, I would like to thank you so much for sharing your thoughts with us this afternoon on the program. We'll be speaking with the Executive Director and the CEO of NPH-CDA. Joins us from our Abuja studio.
Thank you very much.
When we return in a moment, palliatives was a buzzword that came up much earlier into the outbreak of COVID-19 in Nigeria, but a set of people have also received palliative recently. We'll tell you about that when we come back. Stay with us. Welcome back to the program. Now, after the economic loss recorded during the lockdown occasioned by the COVID-19 pandemic, smallholder farmers in Imo State can now heave a sigh of relief, and that follows the commencement of the distribution of agricultural inputs to smallholder farmers by the federal government. At the flag-off of the event at the Hero Square in Owerri, the Imo State capital, the Minister of Agriculture and Rural Development, Mohammed Nanono, says that this action by the federal government is part of efforts to partner with the state government and relevant stakeholders in the agricultural sector to assist in ensuring food security, economic growth, and job creation amidst the pandemic.
We go by the commitment of the Food and Agricultural Organization of the United Nations. Then in the next 10 years, that is in 2030, extreme poverty would have been eradicated worldwide. But that is only if member states of the organization diligently implement pro-poor agricultural policy that has evidence-based strategies and programs that promote inclusive growth and sustainable livelihood. The commitment of the federal government to agricultural growth, as evidenced by this flag-off, is clear indication that our nation is on course towards the realization of the Food and Agricultural Organization dream of the United Nations. However, going by the giant stride the government has already recorded in the agricultural sector, it is almost evident that we are on course to beat the Food and Agricultural Organization deadline of 2030.
Well, economic intervention on the one hand, but let's take a look at how well we're fared regarding health and medical interventions in the country. Health reforms advocate and the former chairman, NMA Advocacy Committee, Dr. Henry Ewunono, joins us this afternoon to explore our response, especially now that schools and worship centers are opening. Good afternoon, and thank you for joining us.
My pleasure.
So, worship centers opening, schools opening, airports opening. We understand that train stations are also built to open, especially for schools now. Started last week, some states opened today. How do you rate compliance across states, and do you have worries?
I do. And worries are just an understatement. The most recent being the burial of the late former senator yesterday. Ijebu Igbo burst to the scenes. Human beings who were informed that their life patron died of this dreaded disease, most everybody wanted to touch the corpse. That is terrible. One of the polls I was privileged to see estimated that over 90% of Nigerians know that this disease is now here with us, and they know that the disease can kill. Yet, human beings are not taking responsibility. I am worried because What the cameras are showing on television screen, on schools, just the gate, and some of the schools in the cities. The cameras have not shown us what is happening in the schools in the hinterlands of Nigeria. It is known that over 70% of Nigerians live in the rural areas. What of schools in my village, down there? What of schools without even access, road access for even cameramen to read there? Do they have sanitizers? Can the people afford it? Do the people believe that it can help? Do they obey social distancing? It's not. In the religious houses, I witnessed that people just hang their face masks on their ear. Some just put it on the chin, and nothing happens. Even some religious leaders, I saw one on set yesterday, claiming that it is unbiblical to wear face mask in the presence of God, that you are doubting the efficacy of God's power to protect. That is terrible. You now see why some people, some of our National Assembly members wanted to introduce that legislation that will compulsorily, make people comply. Unfortunately, this is public health.
Right.
Force cannot be effective. It is only persuasion based on information.
Right.
But our people are not taking responsibility.
No,
so this is where I will call on the PTF
right.
at the federal level, the emergency operation centers at the state level, everybody to come together. There has to be something. There has to be a way to communicate so that these people will get this message.
Okay, I mean, you brought up that debate again. I mean, some believe that this will always be with us. So maybe we should just find a way to learn to live with it. But obviously, you're pro-livelihood, and as healthcare advocate and all, you must have heard people saying that, well, are we still in a lockdown, especially because the government extended the second phase of lockdown? And like you said, a lot of people are not entirely adhering to some of these guidelines. The big question is, what more can we do?
We'll continue to preach. We'll continue to preach. But people have to, especially leaders, religious leaders, political leaders, leaders at all levels. We have to live by example. We have to demonstrate to the people. For instance, if I'm a pastor coming to preach, I wear my mask all the time because I have done it personally, so I know it is possible. I wear my mask to preach, to sing, to lead in prayers. Then when I tell the members of the congregation, follow me, they will obey.
Interesting.
If I'm a religious leader, if I'm a political leader, look at what is happening in Edo State.
Dr. Unonu.
These people are not taking responsibility, unfortunately.
It's interesting
Nobody's
you bring
calling
up
them to order.
the issue about masks, because this is the World Mask Week, and I'm glad you brought that up. So this is a call to action, absolutely, for people to ensure to adhere to those guidelines. But I'd like to thank you so much, Dr. Henry Unonu, who is a health reforms advocate and the former chairman, NMA Advocacy Committee. Thank you for your thoughts.
Take responsibility, Nigerians, please.
Well, Australia has recorded its deadliest day of the coronavirus pandemic amid a second wave of infections in Melbourne City, as in Victoria State. Now, Victoria has now seen about 2/3 of Australia's total 314 deaths and approximately 21,400 cases. Here's more on this and other developments in our COVID-19 Global Update.
State situation.
We look for better news when it comes to the stabilising of cases in Victoria. I'm more hopeful of that today than I was in the course of the past week over the briefings I've received over the course of the weekend and again this morning.
Victoria State, which is home to Melbourne, the country's second biggest city and the epicenter of its second coronavirus wave, reported 19 people had died from the virus over the past 24 hours. With some other states still to report daily new case and death numbers that already marks the country's biggest single-day rise in fatalities. For 101 days in a row, New Zealand has reported no locally transmitted cases of coronavirus. That feat has been hailed as a significant milestone by the country's Prime Minister Jacinda Ardern, whose COVID-19 containment strategy has received international applause. The 21 active cases of coronavirus in the country are all imported cases from people arriving in New Zealand who are in managed isolation.
We'll take a look at our website, channelstv.com. It has the latest updates on the pandemic. All you need to do is log on and access the news in health, politics, business, sports, Africa, and around the world, all at your fingertips. Well, that's the COVID-19 update. Thank you for watching. I'm Kayode Okikiolu. Stay safe.